Welcome to the Medical Device Made Easy podcast. Here is Munir Lazouzi from easymedicaldevice.com. And today, as you've seen on the title, can I sue my notified body? So we'll try to explain to you if you can do that or not. So as just a disclaimer, I'm not encouraging you to sue any notified body or anything. So we are just trying to answer this question. And for that, I have with me my preferred lawyer, so Erik Vollebregt. So Erik, welcome to the Medical Device Made Easy podcast.
Thanks very much. Good disclaimer, Munir. I think the important question is, maybe not should I sue my notified body, but the question would rather be, how should I think about whether to sue my notified body or not? Right?
Exactly.
It's maybe a bit more of a phrased question, but that's probably the way to look at it.
Yeah, and I think we will try today to really answer this question in many ways to tell you if it's a good idea, or if you do that, do it maybe on that way instead of that way, etc. So because so I am having a lot of contact with manufacturers, and we are in contact with notified bodies, and we have them reviewed our work, etc. So sometimes the manufacturers are thinking, oh, they are going too slow. We have to do something. Can I sue my notified body? Oh, the answer is going around. We are not moving forward too fast. I have to sell my products. I want them to put some pressure on them, etc. Should I sue them, etc. So the court is really the place for where some manufacturers want to play this game. And here the idea is just to give you some explanation of how it is working. Can you do it or not? Should you do it or not? And what can be maybe some of the reasons. So Erik is here and has also maybe some personal stories or court things that he has done, he has worked on. So I think it will be really a great experience that we have today. So Erik, the first thing that I want maybe to talk about is if you are thinking of somebody that wants to sue a notified body, what would be maybe the main reasons for that? So do you have some ideas of reasons where we can think of suing our notified body?
Oh yeah, I mean, as a lawyer, I can come up with lots of reasons why you might want to sue somebody else, but with notified bodies, it's mainly the kind of things that I always encourage my clients also to do a little bit of a thought experiment. Like, let's say, for example, you would be in an application procedure for a marketing authorization for a medicine. Would you behave the same way?
Okay.
Because often I think clients make the, mental mistake to see a notified body not as government, but rather as a service provider. And that way they expect basically notified bodies to, come through for them.
Yeah, I think the reason is mainly because first you can choose your notified body. You can go and whichever you want. So it's like, let's compare them, find the one that is maybe the best and can help me, etc. And at the end, you are paying them. So it's not like it's like you are choosing a consultant and say, oh, I'll check this one and I'll pay him so he can provide me documentation, etc. and service. But here we should not look at that on that way at all. So it's not like in the US where you are really talking to FDA. Here we are talking to somebody that was appointed by the EU Commission, by the national competent authority.
Yes, exactly. It's they are mostly private institutions exercising government authority. So, and I think a lot of the misunderstandings stem from manufacturers not completely understanding that this is a hybrid system, which is basically, on paper it's very efficient, because what you do is basically things that you would normally need a state agency for, you can outsource to the market, if you will. And because of this outsourcing to the market, that also creates misunderstanding, because notified bodies do business development. They say, hey, we have fantastic possibilities to help you get your products on the market. We can do it fast. We can do it cheap. We can do it. We have the scope that you need. So that often leads companies to believe that the notified body, if they are not doing as the manufacturer hoped that they would behave, that they are, let's say, not performing under the certification agreement, or that they are defaulting in a way, whereas the notified body might at the same time be doing exactly what the notifying member state expects the notified body to do, and what the rules that apply to notified bodies actually require the notified body to do. So it's notified bodies are also, they're always in a bit of a difficult position, because towards the manufacturer, they're like a service provider, but towards their notifying government, they are an emanation of state, basically.
So the other thing is that you are signing a contract with the notified body, not like you are signing a contract with FDA or with any competent authority or whatever. So you are signing this contract with the notified body. So there is also in the contract some elements that you can look, like we say pricing, like how they will behave, what they will do, which action they will do, etc., etc. So I suppose you can sue them on those contracts, what is written on the contract.
Yeah, well, actually, that would normally be the legal basis if you were going to sue a notified body, because that's the legal relationship that you have with them. Because in some cases there are also some government notified bodies, because the MDR actually explicitly specifies that a notified body can be private or public. But if it's public, then it needs to be separated from the state well enough. But still, yeah, the certification agreement would be the primary instrument. And I don't know if you've ever read the certification agreement, because the certification agreement is also approved in the process of notification. So it's basically, you could say set in stone. That's why notified bodies never negotiate about the certification agreement. And sometimes I've actually had clients ask me, can we negotiate about the certification agreement? And I said, of course, you can try to negotiate about everything, but you could also ask me for God's telephone number. It's probably not going to work, right? Because this is something that notified bodies are actually not supposed to negotiate about, because they're not allowed to discriminate between their customers. And also, what can also happen, of course, is that the reason why you might want to sue a notified body is tort, as which we've seen, for example, in the case that went all the way up to the European Court of Justice against TÜV Rheinland about the duty of care of a notified body. So that could be another way to say that a notified body is acting unlawfully.
So mainly here, it's like a manufacturer has done something wrong. The notified body was looking to this manufacturer. They were not looking enough, apparently, or they are trying to find a way to say, have you really looked carefully of this manufacturer? Because at the end, it damaged life of some people. Are you responsible or not for doing that? So mainly, this is also a thing that the notified bodies are liable to the products that they are letting go to the market. So mainly, this is what the message that was provided by this kind of case here.
Yeah, the European Court said that notified bodies also basically have a duty of care towards broad society in a broader sense than only vis-a-vis the manufacturer. But if you're, as a manufacturer, dealing with a notified body, you would basically always be looking at the certification agreement, which is a document that is normally composed in a completely no guarantees matter. Right? It says that it describes the procedures, it describes what the manufacturer must do, but it also makes it very clear that there's no guarantee to certification, and that the notified body will follow the procedures. And if the following of the procedures doesn't lead to a positive finding of certification, then the result may also be you don't get your CE certificate.
So I have here some quick examples of maybe reasons to sue a notified body. Like if the notified body is missing, I have planned with him a date for an audit. So if he's missing the date of the audit, do you think this is a reason to sue him?
Well, that's an interesting one, because if you look at the certification agreement that notified bodies have, is they limit their liability as far as they can. But contractually, it is not allowed in every member state to completely limit your liability for gross negligence. And you could say that if a notified body misses their deadline, for example, because of gross negligence, then you and you can also show that you have damage and so on. Then that might be one of the simpler cases where you might possibly have success. So let's say, for example, you have a very important date planned, and if you miss that date, your certificate will expire because, let's say, for example, it was, I don't know, 22 May or something this year, and you needed the MDD certificate just before the MDR entered into force. And then it turns out that the auditor says, well, I went to a Formula One event instead because how many Formula One events were there? And it was more interesting than doing your audit. Yeah, then you might possibly say, look, this is gross negligence.
Okay. So I think this is something that is interesting here is the fact that, yes, we have to remember that manufacturers, they have also some deadlines. It's not like they are just kind of doing that for doing that. They have some plan to launch their products. They have already planned maybe some stock in different markets and just waiting for the go from the notified body to then start their business. And missing a date, missing an audit, missing this means that maybe we go 3, 4, 5, 6 months in the future for having another audit, and then 3 additional months to receive the certificate, etc. So it's like it can be really a nightmare for some companies. So I can identify myself because I had this case where a notified body missed the audit date, but I can imagine manufacturers that are really in a deep they have really problems with their management, with everybody, because they missed this certification.
Yeah, and the problem there is that if a notified body moves a deadline, it is rarely a gross negligence or willful intent type of situation, and that is basically that makes it so difficult and also frustrating. I can imagine, but it's frustrating on both sides. I think because I also work for several notified bodies actually, so I also see this process from the other side. And it is also sometimes very difficult for notified bodies, especially if you look at something that is happening now as we speak, both under the MDR and the IVDR. IVDR is even worse, actually, where you can see that there's basically completely insufficient capacity in the market to do all the work. And then, of course, if let's say you already have a certification agreement with a notified body, but the notified body is unable to plan an audit date for you within a time frame that you think would be reasonable, that is something completely different. That is not necessarily gross negligence. Yeah.
So I think, there is we have really to look carefully at each cases one by one and really look at what can be done. In terms of notified bodies, so we have, I think, 2 categories of notified bodies: the ones that are independent, if I can say, and the ones that are part of a government. We have some notified bodies like the Spanish, Turkish ones that are partly part of the government. So in the case we are having these notified bodies, like we are dealing directly with the government. So is there any way to sue them also?
Yeah, I mean, you can always sue the government as well, of course. But if you are dealing with a notified body of which which is basically part of government, it might be that you are dealing with different rules to sue them. So it might be that you would be dealing with the same administrative procedure law that would apply to when you would be appealing a government entity decision. So that's always important to find out. And especially also what I see with the hybrid system of notified body, for example, in the Netherlands, we've had cases where you would think that a notified body is acting on the basis of the certification agreement. So a decision that they take would be, basically a private law, a civil law decision, where in the end courts still found no, this is actually it's a decision about a license, so it is a government decision. So you should have appealed that in administrative court rather than going to civil court with this. And that also makes it very tricky to determine, for what reason should you take your notified body to what court? Of course, if you are going to take them to court in the first place.
So you have really to think of it, if I can say, or to think of your strategy before really acting in that case. So you have really to hire a lawyer, so that's really helping you on this kind of elements.
And preferably, I would say a lawyer that knows what he or she is doing in this respect, because I've also seen lawyers really screw up things for their client by taking a very aggressive posture towards a notified body, which basically then led to a situation where the notified body said, okay, if you're threatening with legal procedures, that's fine, but then we will initiate our threatened legal procedure in our quality system, which means we are done negotiating and being practical about anything. We will first solve this legal issue, and then we will continue with whatever we were doing in terms of certification for you.
Yeah.
So if your lawyer really becomes very aggressive and starts threatening a notified body in a meeting, for example, that's a really bad idea, because it might basically set you back in certification time for a quite long time, and that's sometimes.
So they can put on hold your certification while, as you said, they are going to court, they are doing all that. So you cannot move with your product at all during that time.
Yeah, because the notified body isn't going to do anything, because if a particular element of the certification process is contested, like for example, let's say you are in a situation with a notified body where the notified body says, for this particular very innovative high-risk product, we want you to do a clinical trial with 600 patients.
Yeah.
And then you're like, okay, expensive. Okay, we will try. And then you see your competitor who is going for a CE mark at another notified body, and you find out via the marketing people that all talk to each other, you find out that the other notified body has asked for a clinical trial with 300 people, and the devices are even equivalent. What the shit? Oh, sorry. Right? I've been in situations where like this, and then, what are you going to do? Right? If you then go to a meeting and say to a notified body, this is unacceptable. 600 patients, not possible. The other notified body is asking for 300. Either it's 300 or I sue you. It's a stupid strategy. I often ask clients then, if you were talking to the FDA or you were talking to the European Medicines Agency, you had a meeting where you were going to discuss this number, would you behave like this as well? And then they usually say, well, probably not, because it would be very bad.
Yeah.
And I say, okay, well. Then
so here, when we are going to court, for example, the court will analyze the case. And you have in front of you, or the court has in front of them, an expert who has evaluated everything, who has checked everything. So, I mean, is the court really having enough knowledge to contradict the expert and to say, no, you are wrong, or I give the case to the manufacturer? Or they say, no, the expert is right and you cannot say anything?
Well, the problem there is that courts are usually not experts, because a court needs to be able to a court is a bit like a Swiss Army knife. It can do a lot of things and it can solve any problem, but the screwdriver is not ideal.
Yeah.
The knife is probably not as big as you would like it to be. The saw may be missing, things like that. So the court is never the kind of technical expert that is at the same level as the technical experts of the notified body or even at the manufacturer themselves. So as a court, what you see is that you are sitting there as a judge that might see a CE marking case for the very first time. You don't even understand the system. And then you've got two parties that both say that the other is completely wrong and that it should have been completely different. And then the question is, who am I going to say is right? For a case like that to go in favor of the manufacturer that is saying that the notified body is right, you really must have quite a manifest error on the part of the notified body. And that is basically almost never there, unless the notified body says that gravity doesn't exist or, makes a really crucial mistake in the way the device works or something like that, in a way that the court can actually understand it. It's very easy for the court to say, well, the notified body expert acted within the scope of what is a reasonable margin of appreciation for technical issues. And this is aggravated in cases where a manufacturer is in a hurry and would take a notified body to court in expedited proceedings, because expedited proceedings normally require an even more prima facie case.
Yeah.
And the problem is that these prima facie cases, I almost never see them if a manufacturer says, man, I want to sue the notified body. It's almost never the kind of prima facie case that would allow this.
Okay.
And even if it would allow it, I always encourage my clients to think it through, because you can sue anybody. I mean, that's easy. Suing somebody, it's easy. It's like, it's basically like hitting somebody in the face. You can always hit somebody in the face if you like, but then what, right? Yeah. If it's somebody that you need to do something for you later, if you hit them in the face because you hate them, then it might be that they're not so motivated to do anything for you anymore.
I imagine so.
That they say, maybe you should ask somebody else to do something nice for you because we're not going to do that anymore.
Yeah, no, I imagine that, as soon as you start this process, so as you said, the notified body is putting himself on self-defense. So the case is starting, but the review process is stopped. There is no more movement on that. I suppose it will still remain your notified body for other products, but maybe for the products where you have a conflict, it's like we stop the discussion now until we go to the court and get the decision from the court. But for us, it's not. And you've said, it's this process is mentioned on their procedure, on the notified body procedure. It's like as soon as somebody starts to threaten you on this, you have to hold off, you have to stop this. Here is a process to follow for doing this kind of thing.
And it's also, it's not that you can, let's say, for example, you're in court with your notified body. It might take years, actually. It might take 1 year, 2 years, 3 years, depending on, because even if you win a case against the notified body might appeal. And as long as you are still in a certification agreement with the notified body, you cannot go to another notified body for that device. So basically, you're locked in with the notified body until you've really danced out the whole dispute, basically.
So it's really, I think, a bad idea to. You can move on that way, but you have really to think twice or 3 times before really to go there and to have really a strategy in mind.
Yeah, you really need to think in terms of burning bridges, basically. Am I at a point where I want to exercise the nuclear option, basically? And it's very rare that I see notified bodies behave in a way that I think like, well, now you would start to really have a chance. And it's,
So is there a way, like, instead of starting with a nuclear bomb, we can go a bit, a step before, so where we say, can I just go have a meeting with the notified body and just discuss with them without threatening or mainly without telling I will sue you or whatever? So is the negotiation the best option at that point?
Well, yeah, negotiation is also a bit of a problem because for negotiation, you need to be in a position that you can actually negotiate, right? Okay. And that's also, I think, another perspective problem that manufacturers sometimes have is they go to a meeting and they think, I can negotiate. But that's almost never the case. What you can do is you can be practical and help the notified body reach a different conclusion. That's a bit like Socrates. He would just keep asking people questions and then help them. It's like, for example, when Socrates makes the slave do the demonstration of Euclidean geometry. Yeah. Right, that's basically the way to go to a notified body meeting. You have a good plan, you've got very good arguments, you've got convincing arguments, and then hopefully you'll be able to convince them.
Yeah, I have some cases where we had this, and at the end, yeah, we are doing what you are saying. So mainly the idea was to go with the notified body. We discuss with them. They don't agree with our case. We say we have some arguments. And at the end, when we see there is a blockage, we ask them, what do you need? What exactly is the thing you want to see? And they always start this sentence saying, we are not here to consult you. We are not here to give this information to you like that. But if you go on that direction or on that direction, maybe we should consider. They are using careful words, if I can say, on going through that. But it helps a lot because then at the end, they give you the direction they want you to go. And then you go and you see if this is a possible way for you to finalize your case and then to provide with the satisfactory information to them.
Yeah, and it's a much more productive way because contrary to, for example, if you are going to a government agency like for medicines, because there you get a decision, you can appeal the decision, then you can appeal the decision in court, for example. But the problem is with the hybrid system for notified bodies, you do not have a formal appeals procedure in court as you would have for a government agency. And I think this is actually, as a lawyer, this was one of the really big issues I've always had with the devices system, that there is no good formal legal review possibility of notified bodies' decisions. Because on the one hand, they're exercising government authority, right? They give you a license or not. But on the other hand, you do not have the tools that you would normally have to appeal if a license is refused. And I think I've also defended that when the MDR was in the legislative procedure. I think this is actually one of the big hiatuses in the MDR and in the IVDR, that they never came with a good legal review procedure. They fixed, I think, a lot of the legal issues that there were with notified bodies. Like, for example, what to do if your notified body lays down service, what to do if your notified body turns out to be incompetent and you want to contest their competence, all these things. But still, the normal stuff that you would have for a government agency that does licensing, so a predictable legal pathway towards legal review by a court of a decision, that is still not there. Okay. So I think that might be something for the MDR 2.0 to consider.
Okay. Yeah, I think it will be a good case for improvement. Maybe I hope people from the EU Commissioner or the ones that are making those changes or updates will consider this podcast episode if they are listening to that. So the thing is, So we have talked about that in a previous podcast. We talked about the FDA. So we had a company that sued the FDA because they considered, for example, their contrast imaging solution as devices and not as drug, because in the US it is considered as drug. And apparently FDA lost. So now all those products that are considered as imaging solution will be devices. So you see here on this case that yes, you can sue even the authority like the FDA and win the case if you have really good arguments on it. But it's just a case in Europe, in the US, but it can be the same, I suppose, here also in Europe.
I've also had clients that sued the FDA with pretty disastrous results. So
have good arguments. As I said, don't sue anybody without really a good strategy. strategy. And for that, for me, I mean, you can hire, I suppose, Erik. So Erik, you are helping those manufacturers related to this type of cases, or if they have really just to consult you, can I sue or not? Should I do it or not? Or what is the strategy to do that?
Well, yeah, as I said, always have a good plan, and always think about if I do this, what will it lead to? And I think it even starts earlier by really also looking at yourself as a manufacturer. What is the problem? What is the notified body's problem? And how can I help them solve the problem? That's basically, what is the notified body stuck on? That's always the best question to ask. And if the notified body is stuck on something, what exactly are they stuck on? And what would they need to become unstuck again? And I mean, suing them or threatening to sue them, it's the same way that if your television is funky, well, you can walk to the television and give it a good kick. But especially with modern televisions, it's not going to work.
Yeah.
So rather, it's better to understand how your television works than to become angry and kick your television. And it's the same with a notified body. Basically, better understand what they are stuck on and helping them get unstuck. And for that, it often also takes a very cold eye view of your own processes sometimes. And that's also something that I see manufacturers not always be interested in. Like, for example, is our device really equivalent in the sense that we need the same number of patients included in the clinical trial?
Yeah.
Or, for example, it might be that there's another circumstance that makes the notified body think that they need more people. But this is something you can at least have a discussion about.
No, it's great. So, as I said, don't hesitate to contact Erik Vollebregt from Axon Lawyers for that. I will, I suppose, help you a lot for this kind of cases. Think twice or think carefully before starting this kind of process, because it can be good or bad. But you have really to think twice of it. Okay, Erik. So really, thank you for your help on all this. I hope that this will help people to think what they can or cannot do. As I've said, this is not an encouragement to sue anyone. So we are here really to give you just some information of what you can do or cannot do. But be careful. It's really serious cases here. So don't do anything without a lawyer. And I will, as you've said, don't do anything without a lawyer that is really qualified on healthcare, medical devices, regulations, because I think this is really some special cases. So you should not just take any lawyer for that. Okay, Erik. So really, thank you.
They're very easy cases to screw up, and then your lawyer is happy because they have worked for years, but you have a problem that takes years to fix and is really expensive.
Yeah, exactly. Okay, so Erik, thank you very much, and I wish you a nice day.
You're welcome.
Bye-bye.